something.
All right, Dr. Emer, we are live.
Hey guys, it's Dr. Emer. We're doing one of my favorite treatments today, male facial sculpting. And you know we do this both males and females to give that contour, that chiseled look. My patient's younger, he already looks good, but there's a few areas that we can just enhance his overall look. The key to using fillers is not to overly plump, not to make someone look feminine as they wanted to, give a little bit more structure and anatomy so that he can have that chiseled look that he's looking for. He specifically wants to focus on his jawline. I did some markings for you guys today to show you that it's really important to understand anatomy and bone structure when you're doing this treatment. With him, if you look from the side, come to the side, Jordan, I want everyone to see this. We take a look. His nose comes out and is very in line with his lip. But when we draw a straight line down, look where his chin, it's recessed back. We need to bring that forward like this. And we need to widen it a little bit so he has that bold look. On the 90-degree angle of his jawline, he's much more deficient on the left side than the right side. He chews on the right. So when he bites down, go ahead and bite down. You can feel the muscle popping right here. But on the left side, bite down, very little. So we need to build this out more. So we're gonna start with the chin so you guys can see. We're gonna use Radiesse today. Now, one of the things you can also do is you see how his muscle's a little crinkly there? We call that cobblestone. You can actually inject Botox there and soften the muscle from moving. And look at already, that little bit in the middle, look what it did. Pushed it out. So that pushes the mentalis muscle outward. It's gonna feel really weird. Doesn't feel the best, but we're going like on the bone. Look at the difference already on that half. Now the cool thing is with Radiesse, which is a calcium-based filler that builds collagen over time, he's gonna get a year to a year and a half. It's like doing an implant.
Is there a different treatment or method you can do for this look without filler?
An implant, a chin implant, but then that's a surgery. So this is the least invasive of the choices. I want you guys to see when I build this out on one side. And so I marked some of the external location as we move outward. Now look at that one side. So go ahead and pan over here. Show
That's a
them on
big
that
difference.
side. Look at the difference. And it seems like when you hear people, you say, "Oh my God, you need 2 syringes." That one more open. You say 2 syringes, they think it's a lot, but it's actually not a lot of volume. Each syringe is really, oh yeah, that's a huge difference when you see that. Look at the difference from one side to the other. He's gonna be so happy. It's amazing. So now we're gonna go back to the other side again, right on bone.
So my filler dissolved and I look like a potato.
What?
Someone needs to come in and get some fillers.
Oh my God. Tell him to come in.
Why haven't you put the patient to sleep? We have no need to.
I don't think he needs to.
No.
Guys.
How do you feel?
Hold on, don't talk for a second. In a minute you can. Is gonna be a little numb here. Now we're building it out. Okay, how do you feel?
Great.
He's so happy, you guys.
And he hasn't even seen the results yet.
I can't wait for him to see. He's gonna love it. You just make sure. So the chin is sort of the hot area right now. It really gives the face a much more structured look. And what I'm trying to do with him is kind of widen it a little. I want to get it, his chin muscle is a little asymmetrical, so it's not going to be perfect, but it's going to be a lot better. And again, we're going to that lateral portion. Building it out.
People are hitting on our patient again.
I'm sure they want his Instagram. I know.
People said he's too cute. I wouldn't mind if he slides into my DMs.
Okay, well. So you see his muscle here, and now we widen it a little bit. So let me wipe off so you guys can see. Now I'll take a pan of that. Probably need even a little bit more, but that's a good starting point. I tell people, let it settle 2 weeks. You can always add more.
All right, Dr. Emer, do you have to have no facial hair to get this procedure done?
Of course not. If I can't see, I can't do. So I need to be able to see the face. So now on this side, remember, he has more structure. Wow, that chin looks great. So this side, he has more structure. Look up and look to your left a little bit. So what we want to do is I'm just going to use a little less of the filler here, but I really still want to define out that 90-degree angle for him.
How long does this filler last?
This one's 12 to 18 months. This is Radiesse, again, calcium-based filler that builds collagen.
Someone said, tell Dr. E congrats on his engagement.
Tell him thank you so much. You guys will all be able to see it in People magazine in the future, okay? You wait. I'm gonna now tell him I'm gonna do a big announcement over the weekend. It may be shirtless. I'm kidding. I don't know. Don't know yet. We'll see. Okay, let me see that side. Bite down. Cool. So you guys can see a little bit more of that 90-degree angle now. Wow, that really changed his face. So now we're gonna do that same thing here. You guys see it's really giving them a contour. But again, we're trying to be, you don't wanna go too crazy.
Can you give more pricing for how much fillers go, the ballpark?
Usually $750 to $1,500 a syringe, depending on what we're using. One of my nurses is a little less expensive as well. And is very good. So we have lots of options for you.
Where are we located, guys? We are in West Hollywood, California.
Okay, so now I'm gonna take a look. So I like to let it settle for a second. We're gonna hold there. We might need this one opened. Let me see. I got it. Good. Let's go back.
Someone said, hi, Dr. Emer. I recently had a small amount of Juvederm for my upper lip. It's great, but I have some tiny white spots that show more now.
Oh my
Are there
God.
treatments for those?
You guys, that's called a mucocele, and that can happen with the Juvederm. Bite down again. I would suggest you come see us. We can give you an idea of what we can do. Sometimes that just occurs with HA fillers in the lip in some people. Okay, hold there. Let me go back to the other side.
How much filler are we doing on this patient today? We're doing 4 syringes?
4 syringes, which equates to, with Radiesse volume, 6 cc's for just the lower face. And that's what he needs. Turn a little bit this way. He needs that in this area. Now it's gonna look, it always looks a little bulkier, Radiesse at first.
Don't stop.
I tend to think that that looks really good. I'm gonna wipe him for a second because I have a little bit left.
So ask, when are we going back to New York? That'll be next month in August.
We will be announcing it in 1 or 2 days. We just confirmed end of next month today. End of next month. All right, let me take a look. Hold on, I'll wipe everything off so I can get a full view of his face.
Is this completely pain-free? How do you feel?
I can't really feel much.
Good. Oh God, looks great.
Can you add filler on top of a chin implant?
You can. We did a couple people today, actually. You can, and it can be done by both cannula and. So you guys, I want to do a little bit more still for his chin on this side. This one side's a little more deficient, so I saved just a little at the end.
You guys asked about our New York bookings. They do fill up quick. You guys need to send us a DM, full name, email, and phone number. Mention that you need to be booked for New York, and we will get you in.
Yes, New York gets crazy, but we love it. All right, bite down again.
Guys, this is Radiesse for those of you asking which filler we are using.
Awesome.
He does not have a chin implant. We just did filler to his chin. There are other patients today Dr. Emer did, not on Instagram, that do have chin implants.
Mm-hmm. So using a different technique here. Special technique I developed actually. To give him a little bit more angle because he's asymmetrical. Alright. I'm excited. You know what the next part is, Jordan? What
He's
is
going to
it?
get the Emer reveal.
Emma reveal, so we're gonna do that because I'm super
We're going to
excited.
pass him the phone.
Let's pass him the phone, let me wipe him. So we did it, he actually didn't even flinch, which is insane, he did great. Guys are usually babies, he's definitely not. So, we're gonna show him the Emer reveal, so pass him the phone, not the mirror yet. We're gonna show him what it looks like on a phone. Go ahead,
All right, here you go.
pass it over. Alright, take a look. Now, hold it up a little bit. Watch the light a sec. Let's get one more light. There you go. So then look straight and then turn 45 degrees. What do you think? Look at the chin.
That looks really good.
Projected, it matches your lip, your nose ratio. And then if you look straight, look at the 90-degree angle. If you turn here, look right here. Bite down so you can see. You see it pop out. See if I can move this light a little bit closer. Now look.
Mm-hmm.
Look at the jawline. And look at the overall look. So you guys, doesn't even look like you had anything done. What did you want? What was your goal?
This exactly.
I love that they say that. Okay, so let's switch it now. So you can see it in real time on the mirror because it looks different in the mirror. What do you think?
Love it.
And look at, like, no bruising, much more balance when it comes across. We still brought it out a little bit because we really wanted the projection, but we widened slightly. And then we just really built out at the 90-degree angle so that when you bite, right now, remember, we only did a small amount because I don't want this popping out too much for him. I just want it to look a little more natural. In a couple weeks, if he wanted to add more of that masser volume and build it out, we can. But what do you guys think? Pan and take a look.
Guys, this filler is not permanent, guys, about 12 to 18 months.
Let me take this. It looks good, right?
Mm-hmm.
Perfect. There you go. All right. Yeah, let's see. Yeah, look at it, that 90 degree. Come over to the 90 degree. You guys really can see the angle now and the projection of his chin. Awesome. I'll show him the other side. Perfect. What do you think?
There you guys go. Thank you for joining us.
Exactly. All right, you guys, it's male facial sculpting. Stay tuned to his follow-ups in the next few weeks. Bye. Awesome. Good job.
That's amazing.